Hello everyone, welcome to our video. Today's video is gonna talk about the difference between ADHD and ASD. Wow, what an impressive content. Okay, first of all, we will define what is the meaning of ADHD. It's an attention deficit hyperactivity disorder. Oh, wait a second, what do you mean about this difficult words? To make it easy, we will start with the definition. ADHD is one of the most common neurodevelopmental disorders of childhood. It is usually first diagnosed in childhood and often lasts into adulthood. What are the symptoms of this disorder? In children with ADHD may have trouble paying attention, controlling impulsive behaviors, may act without thinking about what the result will be, or be overly active. ADHD can last into adulthood. Some adults have ADHD but have never been diagnosed. The symptoms may look different at older ages. For example, hyperactivity may appear as extreme restlessness. These symptoms can cause difficulty at work, at home, or with relationships. What is the cause of this disorder? Is it genetically transmitted or what? The cause and risk factors for ADHD are unknown until that moment, but current research shows that genetics plays an important role. Recent studies link genetic factors with ADHD. So the genes you inherit from your parents are a significant factor in developing the condition. How to treat someone with ADHD? There are two main groups of medication: stimulants and non-stimulants. Sometimes antidepressants are prescribed to help manage symptoms of depression that can be common in those living with ADHD. While medicine isn't always a necessary treatment for ADHD, for some, it can successfully treat severe symptoms and help people live a more productive life. Depending on the ADHD type and the severity of symptoms, a doctor will prescribe the medication that best suits someone's individual needs. Now I think you got a perfect idea about ADHD. On the other side, I will talk about ASD, which is known as Autism Spectrum Disorder. Is a neurological and developmental disorder that affects how people interact with others, communicate, learn, and behave. Although autism can be diagnosed at any age, it is described as a developmental disorder because symptoms generally appear in the first 2 years of life. So, what is the symptoms of this disorder? We will summarize it in 6 points. 1. Difficulty with communication and interaction with other people. 2. Making little or inconsistent eye contact, appearing not to look at or listen to people who are talking. 3. Unusual mood or emotional reactions. 4. Anxiety, stress, or excessive worry. 5. Lack of fear or more fear than expected. 6. Having trouble understanding another person's point of view or being unable to predict or understand other people's action. What is the cause of ASD? Researchers don't know the primary cause of ASD, but studies suggest that a person's genes can act together with aspects of their environment to affect development in ways that lead to ASD. So, this is a similar point with the two disorders, ADHD and ASD. What is the factors that are associated with an increased likelihood of developing ASD? Having a sibling with ASD, having certain genetic conditions such as Down syndrome or Fragile X syndrome, having a very low birth weight. How to treat someone with ASD? There is no cure for autism spectrum disorder such as ADHD, which is the second similar point, and there is currently no medication to treat it. But some medicines can help with related symptoms like depression, seizures, insomnia, and trouble focusing. Studies have shown that medication is most effective when it's combined with behavioral therapies. And that's it. The two disorders are similar to each other as you see, but there's a little difference. I hope I help you to understand it clearly. Was with you Ala Ahmed from the Magic Team. Don't forget to follow us for more short medical videos. Bye bye and see you in the next video.